Now to Mark McAllister, who's at City Hall. Mark, now you have more on the city and feds teaming up to help those with COVID.
Yes, Cynthia, knowing that COVID resurgence is going to take place, the city is taking steps to help those who will end up getting COVID-19 to self-isolate if they don't have the opportunity to do so otherwise. An undisclosed facility is being set up with the federal government.
It's another way to hopefully help stop the spread of COVID-19 this fall and winter, giving those infected with the virus, otherwise living in tight quarters, the chance to go elsewhere and keep others safe.
I think it's important to note that what we've done is try to create a comfortable, secure environment so that we can help people recover properly from COVID-19 and do so in a way that takes care of their family members and their entire community.
Toronto Public Health has secured what they're calling a self-isolation facility for 140 people, based at a hotel in one of the areas of the city where there's a higher risk of residents contracting COVID-19. The federal government announced it will be offering nearly $14 million to fund the facility for the next 12 months.
They may be living in congregate settings with roommates in crowded housing conditions. Financial costs can make it impossible or unsafe to effectively self-isolate. And when this happens, of course, this increases the risk of spreading COVID-19 to other people within the household.
Self-isolation at the facility will be on a voluntary basis. Case investigators from Toronto Public Health will be able to determine who is eligible and will make the offer to stay there based on individual needs.
There are lots of opportunities for us to work with individual clients to understand what their unique circumstances are, to determine whether they're eligible for the service, and then figure out how best we deploy the service.
Dr. Davila said that they expect that people would stay for the recommended 14 days, but they would be provided with meals and have access to medical staff if needed, while public health continues to check in.
Not everybody would, even when they're ill and even when they want to care for their loved ones, would volunteer to move away from home for a period of time and live somewhere else. But I think there are going to be a lot of people who will use it because they are considerate of their own family and of their neighbors and of their fellow citizens.
The facility will be the first of its kind in Canada, but others like it have been operating in several U.S. cities as well as China throughout the pandemic.
Now, good news for restaurants in the city who have taken advantage of the Cafe TO program. There is news today that those businesses will have a chance to continue to thrive by staying open in different ways, leading into the cooler weather in the fall. Portable heaters will actually now be allowed on all outdoor patios in Toronto. The city announced the move to help make open-air dining available and more comfortable for customers longer. The Cafe TO program is set to end in late fall, so the heaters will give restaurant owners the chance to bring in more business and continue with physical distancing. More than 760 restaurants in the city have been set up with curbside patios as a part of Cafe TO. And on a final note, an agreement is now in place called the Midtown School Safety Plan. It's been set up with the city, the TDSB, and a number of groups in and around the Mount Pleasant and Eglinton area. They had been concerned with a temporary shelter that was set up at the old Roehampton Hotel. Now, as a part of this agreement, there's going to be new safe and security plans in place, both during school hours and after hours as well.